Hello, everyone. I'm Chris Ruhm with the Ruhm-Insurance Agency. I'm a licensed independent insurance agent located in Cincinnati, Ohio. Today, I'm going to go over Medicare Supplements Plan G, N, and High Deductible G. I probably won't answer all your questions, so if you do have any more questions at the end, you can feel free to reach out to me. You can see my contact information over on the left in the center of the presentation. My name is Chris Ruhm again. My telephone number is 513-335-2465, or you can email me at the email address below. Again, today's presentation is going to be on Medicare Supplements Plan G, N, and High Deductible G. So now we're going to go over Original Medicare. When you get a Medicare supplement, Original Medicare is going to pay first. If Original Medicare will pay your claim, your supplement will pick up the gaps Original Medicare does not cover, depending on the plan selection. So it's important to note, we pay into Part A all our life. So if you ever got a paycheck and you saw the Medicare deduction, that covers your Part A. We have to pay for Part B when we age into Medicare. So if you're retiring and you're going to need Part B when you turn 65, most Americans this year paid $170.10. If you have a higher income, you might have to pay more. I do have a blog. It's called Monthly Income Related Adjustment. So if you are paying more and you made more money 2 years ago, that's the look back period. So go to my blog and you can find out if you're paying more. There might be a way that you don't have to by filing an appeal, and I can help you with that. But we're not going to get into that today. Okay. So Part A is what we paid into all our life, and that covers hospital. Part B is what we must purchase in order to get a Medicare supplement plan that we're going over today. Okay. Part A is hospital. The Part A deductible this year is $1,556. That is a per occurrence deductible, where Part B is an annual deductible. So once you meet the deductible on Part B, then you would pay 20% with Original Medicare. And I'll go over a little bit more of that in the next slide. So this is why we want a Medicare supplement. There is unlimited cost potential when you just have Original Medicare. It is an option where you could just have Original Medicare. If you're not worried about the unlimited cost, it is a viable option. But again, if something serious were to come up, you could be out a lot of money. So that's where a Medicare supplement comes in and helps mitigate those losses. Okay. And then probably the biggest reason people love Original Medicare and a Medicare supplement, there is no network. A doctor can accept Medicare at the participating or the non-participating rate. The majority of doctors take it at the participating rate, and a few take it at the non-participating rate, which will make sense in the future slides. So that's Original Medicare. Now we're going to dive into it a little bit more on Parts A and Part B. So Part A and Part B, just real briefly, I'll go over this. Part A, again, is inpatient hospital. It might be skilled nursing, hospice, home health care. Long-term care is not covered. You need a separate long-term care insurance policy if you're worried about not being able to do 2 of the 6 activities of daily living. Your skilled nursing care does take care of you for up to 100 days. So let's say you did have a stroke and you were in a skilled nursing facility for 40 days, your Medicare would help with that. But after days 100, if you have a debilitating disease like ALS or Alzheimer's, something along those where you need skilled nursing on a daily basis because you can no longer do 2 of the 6 activities of daily living, you would need long-term care, or they start going into your own personal assets where you have to self-pay for. So what does Part A cover? You have a $1,556 deductible. Again, I told you that was not annual. That covers you for days 1 through 60. And then as you can see, days 61 through 90 and days 91 and beyond, you do have some exposure. That's why you get a Medicare supplement. All the Medicare supplements we're going to discuss would make you not have to pay those expenses. Okay. Part B is a $233 annual deductible. So if you were just on Original Medicare and you met your $233 deductible, you would then pay 20% for all doctors and outpatient services afterwards. So let's say you had a $1,000 MRI, well, in this particular case, you would have to pay 20% or $200. That is a high cost for an MRI, but I'm just using it for easy math purposes. Now let's go into the different supplements. So Plan G is considered the richest plan if you aged into Medicare after January 1st of 2020. If you aged in before, it was Plan F. Okay, Plan F was about as predictable as you could get, and it was the most comprehensive. Now G is the most comprehensive due to law changes January 1st, 2020. They were called MACRA. Okay, so with G, it's still very predictable. You're going to pay a premium, and then your only additional out-of-pocket exposure is the $233 Part B deductible. And once that's met, your plan pays 100%. So if original Medicare pays for a claim, then your supplement's going to pick up all the remaining costs after the $233 deductible. So if you go into the hospital for 10 days, it's going to pick up that $1,556 Part A deductible. And then if you had some follow-up doctor visits afterwards and you had to pay the first $233, you will not have to pay for any more after the $233 is met. So people love this plan because it's predictable expenses. The negative side of it is the most expensive option. And if you look at compound rate increases, this plan is going to have the largest rate increases just based off the starting premium. All right, so that's something that people need to consider. And I will go over this plan in a conclusion with a few more pros and cons possibly that you would want to consider. So now I'm going to go to Plan N. This is kind of the middle of the road plan. Plan N is a lower cost alternative to Plan G. You still have to pay your premium just like Plan G. You have the Part B deductible, and then you have co-pays. Like G, you have the $233 Part B deductible only. A is covered. You have $20 copay for doctor visits, a $50 emergency room copay. You're only going to pay that copay if you're not admitted to the hospital. Okay, and then this is a big one that you have to consider: excess charges. So doctors that accept Medicare can take a participating rate and a non-participating rate. Majority of the doctors take the participating rate. All right, they make more money when they take the participating rate. The doctors that take the non-participating rate can charge excess. So if you had a $100 bill, they could charge 15% over that original or over the Medicare charge. So you would be responsible for $15. Not bad on 100, but if you have a $100,000 surgery, that could be pretty painful. So you want to make sure that your doctor takes a participating rate if you are going to go with Plan N. Or if you live in one of these 8 states, Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, or Vermont. And these 8 states, they don't allow excess charges. So it makes a really good option in those states because they can't charge that excess, which is nice. A nice benefit of this plan, it will have lower rate increases because people that are getting this plan are typically a little bit healthier overall than the Medicare Supplement Plan G. All right, so Plan N makes a great alternative. It's probably going to be about 15 to 20% lower in premium than G. And then again, when you think about rate increases compounding each year, this one typically has a little bit lower rate increase percentage, plus it's a lower premium, so it goes up slower than Plan G. All right, now we're going to go over to High Deductible G. All right, this is a super low cost alternative to both G and N. It's pretty simple if you really think about it. It has a deductible of $2,490. Original Medicare is primary until the deductible is met. So you literally carry your red, white, and blue card. No matter which plan you have, you'll carry the red, white, and blue card with you because Medicare always pays first. But in this particular instance, if you go to the hospital or an outpatient service, however original Medicare pays, that is going to be what you're going to have to pay until you get to $2,490 in the calendar year. So that starts over every year. Like like premium increases, that also gets increased every year as well. Typically, it's been about 1 to 2%, and it kind of follows inflationary rates too. So, our inflation's high in 2022, so we actually had the biggest jump in the high deductible in many years, from 23.7 to 24.90. It's typically 1 to 2%. It was close to 5% this year. What people like about this plan, it's the lowest premium. So you're looking at a premium of anywhere from $30 to $50 when you age into Medicare versus Medicare Supplement G, where you might have $120 to $150 monthly premium when you age into Medicare. So it's a much lower cost up front, okay? And then the rate increases are going to be the lowest too, because if you take a 4 or 5% rate increase on $30 versus $120, after about 16 years, you're going to save thousands in premium. So this is a great option for people that are in really good health and are a little bit more likely to take a little bit of risk. If you're averse to risk selection, which we'll go over here in a second, you might like Plan G the best. But let's go over. So in conclusion, let's go over the 3 plans. Like I said, you really can't go wrong with any of the plans mentioned. Everyone has their own risk appetite and what they're willing to take on. Plan G is going to be the most predictable, and it's going to be the highest cost. I mentioned that earlier. People that are averse to risk and have the money to pay this premium is who this attracts. Unfortunately, it also can attract very unhealthy individuals as well, because if you have a lot of chronic conditions, you know exactly what you're going to pay, and the max out of pocket is your premium plus that Part B deductible, which is going to be a lot lower than like any Medicare Advantage plan or even this high deductible G down below. Well, at least in the beginning. All right. If I do have some blogs where I go into high deductible G, if you're going to have mostly healthy years, you can save thousands of dollars in premium just by the compounding rate increases. But in general, people that pick G are like predictable expenses, aren't worried about paying the premium, and like just the best plan available. They can go to any doctor or hospital accepts Medicare. Plan N is a great plan if you're in good to excellent health. You like relatively predictable expenses at a little bit lower cost than Plan G. Now, the biggest risk is going to be the excess, but again, the doctors that are participating versus non-participating Medicare rate are few and far between. Most take the participating rate, so it's very rare that you'll have to pay that excess, but it is a question that you do have to ask with Plan N. You don't have to ask it with G or HDG, just with Plan N. So if you're in good health, you want a little bit lower premium and a little bit healthier risk pool, Plan N is the way to go, because Plan N isn't going to get that really unhealthy person that's going to have to pay co-pays and co-insurance, or I should not have said co-insurance. They're going to have to pay the co-pays with Plan N, which could end up being more costly. And then Plan HDG or High Deductible G is probably the least predictable in some sense. If you're really healthy and you're only going to your doctor once a year, you know you're only going to pay your premium. And if that's what you ultimately expect in life, then it makes a great option that can save you thousands over a 15, 16 year period or more. I did a blog that you can go look at called Inflation, and it compares G to HDG over a 16-year period. And believe it or not, if you met your deductible 10.7 times that high deductible of $2,490, you would still come out ahead with high deductible G in premium cost and out-of-pocket cost versus G. So you'd have to be really unhealthy for G to beat out HDG. Okay, so again, this plan's attracted to individuals that understand insurance and original Medicare. You're in good to excellent health, and you like money working for versus against. As you can see, I'm a big fan of High Deductible G, but again, I don't like to tell my clients what to do. I like them to understand these three options and then be able to make their own choice. And then I do have a couple of blogs, again, that I mentioned that go over these features that might make it more attractive to you. So again, there is no wrong plan. You will be happy with any of these plans because you can go to any doctor or hospital in the country that accepts Medicare. It provides very predictable expenses, your premium plus the deductibles, and you can, again, have a lot of freedom in retirement and know exactly what you're going to pay in your best case scenario and your worst case scenarios. So if you have any questions, again, you can go to chrisruhm.com and reach me. My telephone number again is 513-335-2465. Hope you found this information useful, and let's talk if you would like to learn more. Thanks a lot. Bye-bye.